UNAIDS and the South African National AIDS Council will today launch the Global AIDS Update Report in Germiston. This report, which has been dubbed AIDS Crisis and the Power to Transform, is expected to reflect on the global impact of the donor funding cuts that were announced by the US. The report provides a comprehensive overview of the global epidemic. It includes data on the number of people living with HIV, any new infections, AIDS-related deaths, and access to treatment, amongst other key indicators. The last report in 2024 showed close to 40 million people as living with HIV globally. Our senior reporter, Chriselda Lewis, is watching developments and joins us now live from Germiston. And Chriselda, this is all happening against the backdrop of trying to end AIDS by 2030.
Well, that's right, Ayanda. And with that sudden withdrawal of the single biggest contributor to the global HIV/AIDS response being disrupted, we're talking about treatment and prevention programs around the world in early 2025. So you'd know that international assistance accounts for 80% of prevention programs, in particular in low and middle income countries. You know, UNAIDS' modeling shows that, if the funding is permanently disappearing or disappears permanently, there could be an additional 6 million HIV infections and an additional 4 million AIDS-related deaths by 2029. So at the same time, the number of countries that are criminalizing the populations most at risk of HIV has risen for the first time since UNAIDS began reporting. So, communities, however, being resilient, but, when formal assistance programs are basically broken down. I want to talk about Ethiopia, for example. You had young volunteers in that country who basically took over the baton and, it formed WhatsApp groups to check on their peers. Mothers banding together to support children's treatment. And in the South African context, if we look at it, 7.8 million people were living with HIV in 2024. So most of those statistics are going to be broken down today, and exactly what the impact will now be of this crisis within donor funding. I want to bring in Mr. Rampelane Morwane, who is the Acting Deputy Director General for HIV, AIDS, TB, Maternal and Child Health at the National Department of Health. Sir, thank you very much indeed for your time. Today's quite an important day, in particular because we get to understand part of where we are within the donor funding crisis as well. I see it's something that's going to be touched on quite extensively, how countries have had to remodel what they're doing in order to accommodate what we've since seen, South Africa included, I guess.
Yes, thanks very much, Chriselda, and good morning. The disruptions caused by sudden withdrawal are generally, expected, because it's unlike when people had planned that there's going to be an end to this funding. It then challenged health systems globally, particularly challenging the resilience, the ability to bounce back and reorganize themselves. It's true that the impact is going to be catastrophic. Obviously, it would vary from country to country. But in our country, what we did when that happened was to immediately develop contingency plans to make sure that the services don't get disrupted. So what we then did, we then said, who are we protecting first? So we had to protect a certain number of people, then unfortunately rank ordered them. But we then said, those that were in treatment were the first ones not to stop taking treatment, because that would have been very catastrophic. The second layer was to also strengthen our prevention in terms of the key populations and other people. So what we did, we then collected the files of the key populations, for example, those that were going to off-site facilities that were supported by PEPFAR directly, to take them to our facilities, communicate with them, to alert them that we've got their files. But we went on to work with the civil society under South African National AIDS Council to mobilize everybody to come to the party. So we continue working. So we were relieved when the CDC, Center for Disease Control, continued to do some work, but of course UNAIDS, it's gone. So we communicated with various stakeholders, and our minister met various stakeholders, financiers, people that could contribute, partners, to try to see what we can do. So this is how you sustain the system when there's been sudden withdrawal of support. So that's what we did really. But we are aware that this will create a problem unless some solution is found. And that solution is going to come from all role players working together, by making sure that whoever has resources must come to the party, and then also, remodeling our services. The services that we run from our offside our facilities must be integrated in our own system.
Yeah. And I was just reading through the report, which of course will be launched today, and I mean some significant gains have also been made in sub-Saharan Africa. And the fear now is that those gains could possibly be reversed. That is what the global community is trying to avoid. With these discussions that are taking place currently, what do we expect to hear from this particular report in terms of how these particular issues will be able to be handled? Many gains made, but a huge fear of the reversal of those gains, which you've described could be catastrophic indeed.
Indeed, I mean, if no action is taken, there could be catastrophic implications out of this. But this report will show what has been gained over time, will also demonstrate what the effect would be of the card, but it will further demonstrate what countries are doing. I think you've explained it in your intro, where people then started to close the lager, come together, form WhatsApp groups, peer support groups, community groupings, to make sure that there's no disruption. So human beings normally have a way of bouncing back out of crisis. So we're therefore encouraging every society to come together, because people living with HIV and AIDS are in our society. So there must be support mechanisms. Criminalization of certain amount of work that is being done is not helpful, because it makes people to run for cover rather than them coming forward. MSMs must be supported, men having sex with other men must be supported through services that they require in the manner that they make them comfortable. But I'm saying health system itself must expand in a way that is able to accommodate these other services to avoid the disruption.
Yeah. In the South African context, let's talk about the strides that have been made. We're talking about this global report 2025. South Africa's also made its strides when we talk about the number of people on antiretroviral treatment. But there still needs to be a sense of more education, it seems. There are areas where, areas of concern, in particular age groups, for example.
Yes, the reports, I mean, our own report shows that the infections are worryingly around ages 15, 24, and perhaps even going up to 35s there, or just before 40. And this is a very active group. So our prevention mechanisms are aimed at attending to those areas of work. So we're teaming up with various role players, really. We work with the Higher Health, for an example, in the Department of Higher Education, which then is more focused in the institutions of higher learning, to make sure that we reach out to those, because those are the people that if you don't attend to them, they get out of college, they get out of university, they are young professionals. If nothing is done, you are then going to have a problem. So that is why our drive now, while we've got many people on treatment, is to then focus more on prevention. Hence, we have then introduced pre-exposure prophylaxis program. It's still oral PrEP now that we're doing, but we are excited that its uptake is showing that people are really responding. So as soon as innovations allow us to move further to the injectables, I'm sure at the right time we'll be able to make pronouncements. But for now, PrEP has become one of the interventions that we're implementing, particularly among young people.
Yeah, and I wanted to speak about that. In fact, I was reading about it a couple of days ago, and I understood that it is not in South Africa yet, the injectable. I think, what is it, once a year?
Twice a year.
Twice a year, indeed. The injectable, that is not yet available in South Africa at this stage?
Yeah, no. We're not there yet. We're not there yet, but in terms of implementation science, I mean, we are convinced that this going to be, it will be a major issue the day it becomes available. But I would want to say to South Africa, let's hold our horses for now.
Right.
We're working on the background, very, very hard, to make sure that we find something that, one, could save South Africans' lives. Number two, could save even their time, so that, rather than go and get the pill every day where people may even forget to take the pill, it would work. So you'd know that, interventions that are available through injections, while the injection could have its own pain, but, they are easy and safe to administer, easy in that you don't have to go back again. You can't forget the pill. But I would say for now, let's hold it there.
All right.
At the right time, I'm sure the authorities will
Indeed.
make an announcement.
Indeed. Mr. Rampelane Morwane, thank you very much indeed. We do appreciate you waking up so early to come and speak to us. And sorry for keep you waiting.
It's my pleasure.
All
Thanks
right.
very much.
Thank you very much, sir. Thanks indeed. The Acting Deputy Director General for HIV, AIDS, TB, Maternal and Child Health at the National Department of Health. Of course, we're anticipating the release of that global report. The figures would be quite interesting, I think, Ayanda, in light of the strides that have been made and how those strides could possibly now be at risk, given the donor funding that has now been stripped. A number of countries having to find ways to bridge this particular gap to ensure that the gains that have been made will not be eroded.
Sure, no overstating the importance of that report and, of course, the plans that are likely to unfold thereafter. Chriselda Lewis, our senior reporter, live to us there from Germiston. For now, thanks very much indeed.